Welcome to the Healing Pain Podcast with Dr. Joe Tatta. Each week, we interview top experts in physical therapy, pain science, and integrative pain care. You'll learn the most up-to-date information for treating and reversing persistent pain. This podcast is for educational purposes only and not intended to be used as personalized medical advice. And now, here's your host, Dr. Joe Tatta.
Hey there, friend. Welcome to this week's episode of the Healing Pain Podcast. This week, we're discussing how to use the body as a metaphor to overcome chronic pain and suffering by combining yoga with acceptance and commitment therapy. If you've been following along with this podcast, or you've taken some of my courses, or perhaps read my book, Radical Relief, you know that metaphor is essential in the treatment of chronic pain. Now, metaphors can begin as very, very short, tiny little sentences, such as motion is lotion. That's a metaphor that David Butler created. Or they can be longer, more drawn out story-like metaphors that really help tell the story of what's happening in the body and the mind of someone with pain and what they can do to overcome it. So for example, in acceptance and commitment therapy, we use longer story-like metaphors. So for example, tug of war with a pain monster or struggling in quicksand. You'll find those in my book. They're also common in almost every single ACT protocol that's out there. But as you become well-versed in ACT, you start to create your own metaphors. So for example, the protector within is a longer story-like metaphor that I created that you can find in my book, Radical Relief. Now from there, especially as a physical medicine professional, the natural extension is to not only talk through these metaphors, but actually take the metaphor and combine them with movement. So in essence, put the metaphor into motion. How can we use the body as the metaphor? How can we use the body as a way to tell the story about the metaphor? One nice way to do this is to use yoga. So to combine yoga with ACT. And this makes sense because both yoga and ACT have deep roots in the traditions of mindfulness. And when you combine ACT with yoga, it creates a nice holistic mind-body program that integrates psychology together with yoga and supports behavior change, which is the one thing we're always after. We're after changing someone's behavior so they can overcome chronic pain. And as you begin to weave together the psychology of pain, yoga, behavior change, metaphor, and movement, this enables your client to understand how to gain emotional balance, how to promote better mental health, as well as physical health. And then they start to embody the perspective that healing requires both the body as well as the mind when it comes to overcoming chronic pain. My guest this week to discuss how to use the body as a metaphor is Dr. Ashlyn Mullen. Ashlyn is a New York City-based psychologist who has extensive training in ACT, yoga, as well as health psychology. She specializes in treating those struggling with anxiety, chronic illness, chronic pain, insomnia, grief, as well as life transition. Okay, if you're new to either ACT or yoga, I think you'll find this really interesting. If you're a licensed health professional who's taken my ACT for chronic pain course, I think you'll see how you can really start to use what you learned in that course and apply it to the body. Okay, let's begin this week's episode and meet Dr. Ashlyn Mullen. Hey there, Ashlyn. Welcome to the Healing Pain Podcast. It's great to have you on this week.
Hi, Joe. It's great to be here.
I'm excited to talk to you about your work. I know you have one great paper that's published. That name of that paper is called Curriculum-Based Yoga and Acceptance and Commitment Therapy Training and Intervention for Undergraduate Students, a Mixed Method Investigation. It's published in the 2021 Journal of Contextual Behavioral Science, if anyone wants to access it. And we'll, of course, link to it in the show notes so people can read about it. I was interested in chatting with you because I know there's been some work done in the realm of comparing CBT to yoga.
Yeah.
And there has been some less with comparing ACT to yoga. And I know that's what kind of the body of your research currently focuses on. I guess a good place to start is what gave you the idea for this study?
Yeah, so I've always been very curious about how the mind and body intersect. And I had a lot of experience in ACT. My master's was very ACT focused, and I practiced yoga really to cope throughout grad school. And I saw the connection between yoga and ACT there. And I really, as I was going throughout my doctorate, I saw in other ways, like you just said, it was used in CBT and other therapies, how it can be targeted to help with different psychological issues. And I thought, why not use it with ACT and try it out? I was very fortunate that they let me, create and implement this like yoga and ACT study for my dissertation.
Yeah, they're both relatively, I guess you could say, new to a certain extent.
Yeah.
As far as the research goes, there's a huge body of research on CBT, and there's a huge body of research just on general exercise, so to speak, for obviously both physical and mental health conditions. But when you start to kind of niche down into those areas, like ACT is a newer form of CBT, and yoga, as far as the mindful movement aspect of it, there's less with regard to trials. So I think it's really interesting that you're taking things that are less well studied and saying, hey, let's combine these and let's kind of study them and pick them apart. And specifically, you study this with regard to college students. Is that right?
Yep. Yeah.
And why college students? And maybe you can just give us a little bit of context around what college students experience in the realm of distress.
I think, no, that's a great question. College is a very stressful time and a time of transition, and a lot of things come up for them. There's a lot of things that they're juggling. Especially with my population, there's school, there's work, some people have families, and it's just a very difficult time. There's a lot of research showing high levels of psychological or high pathology in the college student population. And I thought that this would be a great area to try out this protocol with ACT and yoga.
Right. And then I guess within the university setting, of course, there are counselors that are there for people. Some colleges have significant counseling centers, and other colleges have less services available. So I think that's important to think about.
I worked at a few different college counseling centers throughout my training, and we were only allowed to see people for 6 sessions because there was just such an influx of clients and such a need too. So we had to see them for 6 sessions and then refer out after that. So it was really like triage. There's definitely a need.
And your particular study embedded kind of this ACT yoga approach into the curriculum, meaning they took it as like a class, like you would take a normal university class, right?
Yeah, we came to them, and I think it was great to show, this is what mental health can look like. And if you are open to it, maybe you can follow up with your college counseling center. But it kind of gave them a glimpse of that. And I think it gave them a glimpse of just like psychological health and well-being.
Great.
Really
So
what we wanted to do.
Yeah. So I think it's great. You brought the services to them, so to speak. So in their environment, which I think is really important. So often, the places we treat patients or provide services are more sterile clinical-like settings. So this is actually in the university setting.
Yeah.
And then there were 3 different groups that you had in the study, right?
Yeah. So we had an ACT and yoga group. We had an ACT only group, and then we had a control condition. Okay.
So just ACT combined with yoga and a control, which usually typically is like an education session or something like that.
It wasn't an education session. They just got the same measures. It was, there was no treatment intervention.
Okay. So no treatment. And how long so sometimes these are, rather long, twice a week for 6 weeks. How much of an intervention did they each receive?
So the workshop itself was only an hour and a half. And there were measures given before the intervention. So a week before, and also consent, like, are you willing to, is this something you're open to doing? Then there was the hour and a half intervention, either yoga and ACT or ACT only. We did have an additional piece where we sent text messages that were prompts related to the workshop, and that was over 4 weeks. And then, so 4 weeks past the workshop, we did measures again, or we administered measures again.
So it sounds like it's just, as far as the intervention, just a 1.5 hour session for them.
Yeah.
So it's kind of relatively brief, which is interesting.
Yeah. And that's something that, like, if I were to do differently, and if I had the option to, I would have like multiple sessions. I think it would just increase dosage and would be better.
Yeah.
The downside is I can't take up class time for interventions.
Yeah. It is interesting to think about that dose response, because in one way it's like, hey, if we can implement this in an hour and a half and there's good outcomes, then maybe there's a place for a brief intervention. And then it's also nice to know, however, when we up the dose, so to speak, and the frequency, the potentially outcomes are greater. What did you expect to see from the intervention? What were kind of like the hopes and the big vision?
I was hoping that there would be a greater decrease in psychological inflexibility with the yoga group compared to the ACT group, and definitely compared to the control group. So I was hoping that the additional piece of yoga would show like greater psychological flexibility, reduced distress, more so than the ACT group. That's what I was hoping for.
And what did the results show?
So the results showed that, very interesting, that after the yoga and ACT group, there was a heightened level of psychological inflexibility immediately after the workshop, but then it went down following that 4-week follow-up. And so that was that was very interesting and something that we reflected on and what that means. And what we found from other ACT studies, or what research has shown, is that after an ACT intervention, there is a heightened level of psychological inflexibility, because what am I doing in that workshop? I'm asking you to be open to the things that you may not want to be open to, things that we may avoid, or the struggles. So if I'm giving you a measure immediately afterwards, you may be like, wow, I do have, some struggles going on, and report higher levels of psychological inflexibility.
That's really interesting. Yeah. In your study, you have that graph, right?
Yeah.
And there is like this, like, as you mentioned, there's a spike. It's like this upward trend of psychological inflexibility. And then it comes way, way down actually at the post-intervention.
Yeah. Well, and I think what's really salient is that it's higher. It's so much higher than the ACT only, because really, we really tried to match the two interventions to be identical, except that the yoga just had movement pieces included. So I think that, movement also, and I think that movement really heightens your sense of what's going on in your body. Like in the workshops we did, we had the students get up and move around, and you're more in tune with what's happening.
Can you explain a little bit to us, like what this looks like? So, most people can imagine what yoga looks like because we're pretty familiar with yoga. Yeah. And for those who understand ACT, they realize, okay, there's some training of the 6 psychological processes in there. But what does it look when you combine that ACT and that yoga group together?
Yeah. So what we tried to do is we tried to find postures that reflected certain ACT processes. So let me think. For example, acceptance. What we had them do is think of it something that they're struggling with, and try and hold it in goddess pose, which is like this, and kind of like a squat, and notice what's showing up for you as you hold it, and to sit with it as long as you can. And then to go to star pose, which is like completely out, and going back and forth. And what is it like to hold these struggles while in these different postures? So that was something, really, we just made it up. We were just trying to think, like, what movement do we feel embodies acceptance? So that was one example. And also yoga has a lot of mindfulness in it. So the mindfulness piece that we used was like 3-part breathing, or Durga breathing, where you use the 3 chambers and really controlling your breath. Instead, for the values, instead of using values, we use mantra, like finding your mantra and what gives you, what's something that you can tell yourself to give you comfort, and setting an intention, which was like committed action and intention towards that mantra.
It's really interesting because you're really using movement and the body as a metaphor for certain aspects. Just that goddess, that star pose, really you're starting to say, okay, how do I use the body to explain, let's say, acceptance to avoidance, basically, right? Because then you can start to cultivate that psychological flexibility and psychological inflexibility. Yeah. And so it wasn't actually a yoga class with like ACT instruction on top of it. It was taking poses and discussing how it relates to those processes, basically.
Yep, exactly. Okay. We also had a exercise where students got into tree pose, which is a balancing pose. So we had them get in a circle and try tree pose alone and notice what's showing up and maybe the difficulty with that. And then expanding their arms to their partner and using their partner as support, and noticing the difference with that, and how much we can all like relate to this struggle together, and how much supportive you feel, or balance in a sense you feel when you have each other. So that felt to me like very powerful in the workshops.
Yeah. So you're a little bit surprised at the outcome, that the ACT plus yoga group really didn't have significant differences. Is that correct?
Yeah. I mean, I was hoping that would be, but.
Yeah. There, as I mentioned before, there have been other studies that looked at ACT and yoga. And it's interesting because yoga does have a mindfulness aspect to it. Mm-hmm. So I always wonder, how do we design, and this is all very technical, how do we design these studies to really tweeze out, what's happening in the study? Because since yoga involves both exercise and mindfulness, how do we start to differentiate just mindfulness from ACT, so to speak, when we, insert it into the, into the program, so to speak? And then there's also an aspect of just exercise instruction alone mm-hmm. can in some way promote health, both physically as well as psychologically. So there's so many different levels to that, which I think is all really interesting.
And it's so hard to measure and like pick apart what is this like active, treatment piece.
Yeah. And, again, a little technical, but I was looking at the measures that you used in the study. Mm-hmm. Were there other measures, like now that you've completed the study, do you feel like, well, maybe we should use a different measure for this study, or something that may have been more appropriate or more sensitive for this particular, for the aim of this particular study?
I think it would have been helpful to have like a mindfulness measure alone, and to track that over time. I think that would have been interesting to do. Something to add, maybe more qualitative measures too. We did have some qualitative measures at the end, because really this was a feasibility study, and I wanted to see like, what was your reaction? Did you like it, not like it? What helped?
Yeah.
But
because it was, as you mentioned, it was a mixed method study. So what was some of that qualitative input that came out of it? How did people respond to this ACT yoga intervention?
For the most part, people said that it was very helpful, that they enjoyed it, that they felt like they dealt with stress better. I was kind of surprised because there were 3 or 4 people who said they stopped smoking, which I thought was great. We weren't targeting smoking, but it's amazing. And there were a few who said they're sleeping better. So it was nice to see like behavioral changes, as well as, feeling less stressed. And a lot of people said more grounded or more mindful. So it was great to see that feedback and receptivity.
Yeah, because you weren't necessarily targeting those lifestyle behavior change aspect, but it just came through. But why do you think that came through? Was it just in the values work, or was it they had more heightened awareness of the avoidance type activities they engaged in when they were experiencing distress in school?
Yeah, no, I also think I got a lot of feedback on the discussion of being on autopilot, and how we're on autopilot all the time, or not all the time, some of us are. And, what are you missing out in that? And what is it like to be in the present moment and to slow things down? What's actually happening right now? I think that piece could be related to it. And also the mindful eating, which was like, we really walked through like, what is it like to observe this chocolate, observe the wrapper? What is it like to feel it? And we really encourage people to use that practice in other places. And maybe it showed up in smoking and sleep.
There's a movement in the world of physical therapy and other specialties, specifically around chronic pain, of more psychologically informed to psychologically based care. So it's combining psychological interventions with the more physical interventions, which I think a lot of your work centers around. I'm curious, do you notice that movement in the world of psychology specifically? Because obviously you're working intensely with the mind. Is there a movement to start to weave in more movements, somatic changes, somatic interventions, and are you using some of that in your daily practice?
I think that there's absolutely a movement for movement that you're seeing so much. I mean, when I was creating this, I was surprised how many books there were. Yoga for emotional trauma, yoga for stress, yoga for anxiety. I have like a lot of different yoga books. And I am trying to move it or incorporate it in my practice. I often talk about, are you exercising, especially during this pandemic, are you getting up? Are you moving? Why don't you, take a break and go walk around the block? And we talk about doing different exercises. I've done some chair yoga in my private practice, but I've really considered having a class, once we can go back in person and incorporating yoga into like some type of group therapy.
Yeah. Yeah. Because I'm just curious, when you I guess approached your mentors and things like that, were they a little bit like, wow, this is a little more in the physical space and less in the psychological space, or were they very much like, it's really interesting to look at the overlap of the two?
I think that they were very supportive. All three are very, I feel, supportive of incorporating movement into therapy. Something to think about is just when you're doing it in research, there's just a lot of obstacles or barriers, especially with movement. What if someone gets hurt? What if someone can't do that movement? What if there's a disability? And I think with yoga, there's always, you're finding modifications and you're meeting the person with where they're at. And that's what we did in the class, but we really had to be very mindful and aware of what practices we're introducing to this large study of people.
How would you like to see this work evolve?
I would love, like I said earlier, I would love to have some type of like group therapy where we incorporate movement, and it would be nice there's something nice about the connected piece. It would be nice to have like the same group of people once a month or something like that, or have, a text message piece with different meditations each week, and then meet again once a month and have a class. I think that would be really great. And also it would develop a sense of community, I think.
Yeah, the group aspect is so important, especially with all these chronic health conditions, but chronic pain, particularly, lots of research around how groups can be extremely supportive, and then facilitating groups, I think, is a rewarding experience for practitioners as well.
Mm-hmm.
Ashlyn, it's been great speaking with you today. Great work. And of course, we'll link to that article in the 2021 Journal of Contextual Behavioral Science, so everyone can access and read it. In the meantime, let us know how we can learn more about you and follow your work.
Great. Thank you. So I have a website, dramullen.com, and you can go there and learn more about me.
Excellent. So make sure to check out Ashlyn. Her website's pretty easy. It's dramullen.com. That's dramullen.com. At the end of every podcast, I ask you to help us out. Share this with your friends and family and colleagues on Facebook, LinkedIn, Twitter, Instagram, where everyone's talking about ACT and the influence of yoga and how those two converge and can be used for effective treatments for both physical and emotional distress. Hey, if you're on Instagram, make sure to tag me. Take a screenshot of this week's episode, and then you can just tag me. My handle's really easy. It's at drjoetatta.com, and I'll be sure to tag you back. All right. Look forward to seeing you all here again next week. Take care.
Thank you for listening to the Healing Pain Podcast with Dr. Joe Tatta. To subscribe to the podcast and learn more, visit Integrative Pain Science Institute.com. That's Integrative Pain Science Institute.com. Sign up to receive weekly updates, leave a review on iTunes, and share this episode with your friends.